Insights from the world's best medical minds. This is TheRightDoctors.com.
So my first question to you, Dr. Hardeep, is how is this disease transmitted?
Good evening, everyone. So while from the epidemiological studies from Wuhan, it was initially found that animals are the original source of this virus. But as the outbreak has progressed, the virus is spreading mainly from person to person. It is mainly human to human transmission between people who are in close contact, that is within 6 feet, and through respiratory droplets which are produced when an infected person coughs or sneezes. So because this virus can survive for several hours on surfaces such as tables, door handles, table surfaces, so a person can get COVID-19 infection by touching these surfaces or object that has the virus on it, and then when you touch these infected surfaces and then you touch your hand on your mouth and nose and eyes, so the person can get infected like this. So on an average, one infected person can infect about 2 or 3 people. As I said, that human to human transmission is the main mode of transmission right now. So the main precaution which everyone is emphasizing these days on media and everybody is saying that please maintain social distancing. It is the most important thing to prevent this infection, social distancing. And if somebody has come in contact with suspected COVID-19 case or a confirmed COVID-19 case, then self-isolation is must. Please do not hide from healthcare workers. It will be a disaster for all of us. Because you are the head of the Department of Cardiology, what difference does this infection makes to the cardiovascular patient? How is it affecting the cardiovascular patients?
So that's a very good question. Let me first re-emphasize what Dr. Hardeep has said, and she's articulated it very well. Hand hygiene still continues to be one of the most important things, and please follow the 6 steps as have been defined by the World Health Organization. It is important. If it is said that 20 seconds with a sanitizer, well, it should be 25 seconds and not 15 seconds. If you don't have a sanitizer, soap works, but soap will work for 1 minute. You will have to do it and again you will have to do the same 6 steps. And you can do it routinely. You can do it after every hour, after touching. So it has to be done routinely. Secondly, social distancing. If somebody is at least about 6 feet away from you, it's unlikely, as Dr. Hardeep said, unlikely that you will get affected. But don't take a chance. You should be, while you walk in the morning, for example, you can have more distance than that. Quarantine, self-isolations, these are 2 things that have come out very well. And I think the Prime Minister call on Sunday, this last Sunday, that please, my fellow men, do not get out of your homes from such time to 9 p.m. really was a very clarion call, and it made things easier and now of course many cities, many municipalities have said lockdowns. All these things are important because, as has been defined, transmission is important, is the way to go. And I think Dr. Hardeep also touched on the point that it may even be going by airborne. What do we do for cardiac patients? I think the next wave that is going to come is that these patients will be getting affected by, the cardiovascular patients will get affected. Let's go by data. If you look at what happened in if you see what happened in Italy, there were 59,138 cases, of which 5,476 were deaths. And if you look at it, 75% of these were hypertensive patients, 35% had diabetes mellitus or combinations thereof, and fully 33% had heart disease. So which means that we as cardiologists have a special role to play in these difficult times, because corona can affect, COVID-19 can be a disaster for our patients. Let me just start here with one statement, and then Dr. Hardeep will take it over, that it was a we were told that you can't use ACE inhibitors and ARBs for our patients. Now, many of, I'm not saying majority, but large numbers of our patients are actually on ACE and ARBs. And if we were to stop these medications, certainly there would be a disaster. Now there is sufficient information both from the European Society of Cardiology, the AHA, and our own organizations that we can actually continue these medications. Heart disease is the number one killer in the world and will continue to be number one killer, and this coronavirus will only add to the burden. Here, let me also say that a lot of our patients of cancer, for example, also have heart dysfunctions, and these patients are also at very high risk of further deterioration of the condition. Dr. Hardeep, you opened this topic about cardiovascular disease, and both of us are heart specialists in the realm of the corona epidemic. What do you think patients can do? One thing we are clear that they should continue their medication, but actually take it really very, very seriously. What other things do you think they can do in these hard times?
As you said that cardiovascular patients, they are at high risk of severe coronavirus infection. So though we are not dealing directly with the coronavirus patients, but when we see patients in the OPD, it becomes very important to emphasize to them that they are at high risk of these infections, and all those precautions which are taken by is taken by everyone, and we are recommending to everyone. We specifically ask them that to follow all those precautions like hand sanitization and social distancing and avoiding crowded places. But at the same time, because these are the cardiovascular patients, so when we always advise them about the lifestyle measures for doing exercise and follow good diet, for all cardioprotective lifestyle measures which they have to follow. Now in this period of lockdown, when patients cannot go out for exercise, they cannot go out for walks, so this does not give them excuse to avoid all kind of exercise, because exercise is important in their is an important part of their treatment. So in that, now we have started discussing this thing with the patient, that because you cannot go out, because you should avoid crowded places, so is it possible that you can create a small setup at your home for workout? If you can do some kind of stretching exercises, some kind of other exercises which you can do at home, and you can also start doing yoga and meditation, which can be helpful. And then another thing, like many times patients ask us that what can they what should they eat. So obviously they need to follow very healthy, strict diet, but sometimes we tell them, okay, once in a while you can have sweets, once in a week you can have high calorie diet, it's okay. But now, because they are not exercising that much, so we ask them to strictly follow the healthy diet, and no cheat days are allowed now, as till there is lockdown period. And then another thing that sir has already told about the role about the controversy regarding the use of ACE inhibitors and ARBs in these patients, and now we try to continue ACE inhibitors and ARBs in these patients because the beneficial effect is much more. Now, as far as this COVID-19 infection is concerned, there is no specific treatment for this infection. So most of the patients are treated symptomatically and supportive care is given. But for patients who have severe COVID-19 infection, the various healthcare workers, they have used various combination of drugs, and there are mainly 4 promising therapies, and WHO is also focusing on these 4 most most promising therapy. One is the remdesivir. It's an antiviral compound, and then there are antimalarials, chloroquine and hydroxychloroquine, and then they have also used combination of two HIV drugs, that is lopinavir and ritonavir, and also in combination with interferon beta. So some data has already emerged. Recently, WHO has announced a large global trial called Solidarity to test the efficacy of these drugs in patients with severe respiratory disease. Now, as far as chloroquine and hydroxychloroquine is concerned, now there is because this drug is easily available, so some people think that can we take this drug to prevent this infection or to get rid of this infection. Now I would like to tell a small background that during this outbreak in the China, various Chinese researchers, they have used this drug in some patients, not only in China, South Korea and France, and the drug was found to be efficient in clearing upper airways from the virus in 3 to 6 days. Now this use was based on the fact that these drugs, they have shown in vitro activity against COVID-19 and other coronaviruses. So now the drawback with this is that the researchers, they have looked only at a very small subset of patients, so which means that we cannot use this in every patient. Obviously we need wider testing of this drug in large number of patients, and but the latest update regarding hydroxychloroquine is that the National Task Force for COVID-19, which is constituted by ICMR, that is Indian Council of Medical Research, they have recommended the use of this drug as a prophylactic treatment in patients for high risk population. So by high risk population, I mean asymptomatic healthcare workers who are involved in the care of COVID-19 patients, either suspected or confirmed cases, or asymptomatic household contacts of lab confirmed cases. So this is the high risk population, and ICMR says that we can use hydroxychloroquine in these patients as a prophylactic treatment. But having said that, I would like to say that if a person is taking prophylactic treatment like hydroxychloroquine, that does not mean that he can have this false sense of security that now he can go to crowded places because he has taken hydroxychloroquine. No, he has to follow all those lifestyle measures which every one of us is following these days: hand sanitization, social distancing, and avoiding crowded places. Everything has to be followed, and if you have come in contact or if you have any suspected symptoms, then self-isolation is also recommended.
I think in this context, very rightly, Dr. Hardeep, you have pointed out, I think in this context it's also important to re-emphasize that some NSAIDs like ibuprofen, their use should be minimized, because it is said that even the French government recently issued a warning about their use being associated with worse outcomes, and they say that paracetamol is a safe drug. So these are difficult pharmacological decisions, and when the patient is in front of you, these are difficult situations, but at least we should avoid doing any further harm to these patients who are already. Apart from this, we have to tell our patients that they have to maintain good hygiene, they have to maintain good diet and hydration. These are important things in these difficult times, because sometimes many of the elderly patients are alone. They are being told that, well, you're quarantined. Will they be actually eating that much? Will they be doing yoga? Will they be doing pranayam? All these things are important. And in this context, I also bring to you another aspect that not only cardiologists but every department, because people are stretched, medical caregivers are being stretched, nurses are stretched. So what we are doing in our own department is that we are trying to give turns to people that they can rest for a night, come back after 2 nights, and we really emphasize on them about their hydration levels. And any sign that we see that this person is showing signs of fatigue, we tell them politely that leave it at that, some other people will take over. These are important because the caregiver is at the forefront. He's actually on the front, and he should not be hurt with a bullet. He has to save a lot of lives. So these are some of the things that we are doing. As a last thing, I and Dr. Hardeep have done a lot of work in just accessing the data on where we are. The one thing that we both felt is that in our country, we should be actually testing more people. I mean, this is the South Korean experiment, this is the Singapore experiment, this is the way Hong Kong went, and they could, of course, you can say these were smaller countries, they were much better off financially, whatever said and done, but we must really be testing far more people to actually pick out those people who have a disease amongst themselves, and then of course we can quarantine them, we can give them medication. There seems to be hope on the horizon, but we should never leave the fact that cardiovascular patients, which comprise a majority of our patients in our country, should not be ignored. That, well, this is a lung disease and it's not going to harm you, but we both have been looking at the research from Indian Council of Medical Research, and if maybe they're giving us a hope of how we can give prophylactic drugs. Anything else you would like to say?
I think all of us can contribute in one or the other way. It is not just that the healthcare workers are responsible for everything, or it is not just that the government will do everything. All of us can be can help and can contribute. Like as far as the patients are concerned, we request them that if there is no emergency, please we can postpone the routine visits because it is for your own goodness.
Yes, that's good. I think the Prime Minister articulated this very, very clearly, that elective surgery is elective. But definitely, if you have chest discomfort, if you have shortness of breath, if you have palpitation, don't think that if I go to the hospital I'll get more infection. No, we'll keep you safe. We'll keep you in an area where there are no such patients there, and because your condition may actually warrant hospitalization. Also, make full use of modern digital world. Make use of telemedicine. This is where we should go. You have any problem, you post it to your doctor, ask him on the phone or get on the video and say, look doc, I'm okay, but my BP is not getting controlled. What should I be doing? Rather than making a routine visit. So with that, ladies and gentlemen, I and Dr. Hardeep would like to sign off at this level, but we will only say, keep safe, look at everything very, very carefully, don't touch your faces, hand hygiene is important, self-distancing is important, and if you have any queries, if you have any doubts, if you have something in your chest, if you are getting short of breath, please meet a doctor. He will look after you. He will tell you whether you got this disease or it's exacerbation of your pre-existing disease. So with these few words, countrymen, I truly hope that we do not go from phase 2 to phase 3, that we contain ourselves by good discipline, by going the straight route, by walking the line, that we don't get this disease and this infection. Thank you very much.
Insights from the world's best medical minds. This is the Right Doctor.